All right, Dr. J, we want to know, what is nervous system health and why is it important?
So I think in order to explain nervous system health, we have to just at least get the basics of the nervous system. What is the nervous system? Nervous system essentially is your brain, your spinal cord, and all of the nerves that come out from your brain or spinal cord. And that includes your what we call your somatic nervous system, or what's under conscious control. So I want to move my arm. That's your somatic nervous system. Then you have your autonomic nervous system, which functions regardless of you doing anything at all. And that's your sympathetic, so of course, fight or flight nervous system. And then your parasympathetic nervous system, which is rest and digest, chill out, be calm, sleep, etc. So those are going to all broadly speaking, that's what your nervous system is. It's all of that. The reason it's so important is that your nervous system, especially your brain, but all of it, is your master regulator system, your master command system, control system. I always call it a top-down approach, not just because your brain's in your head, but because your nervous system controls your hormonal system. Your nervous system controls your digestion. Your nervous system controls pain and mood and basically everything in your body. You know, I always say, if you don't have a brain, you don't have a life. You can live without your part of your liver, or without your gallbladder, or without a kidney. Can't live without a brain. Like, no brain transplants, doesn't happen. So you need your nervous system. And when your nervous system health is strong, generally speaking, outside of, more specific pathologies, the rest of you is strong and healthy as well. So by keeping your nervous system strong, you're eliminating probably 80+% of chronic illness and other forms of suffering, whether it be mental health or otherwise.
Okay, so why is it that your nervous system controls like 80% of the things that you're experiencing?
Just based on, essentially, without getting too medical about it, everything functions based on nervous impulses. So when you eat and your stomach secretes acid to digest, that comes from your nervous system saying, we just ate, there's signals coming in, parasympathetic nerves start to act on your stomach and then lower organs, and you digest without thinking about it. You're not thinking, oh, I need to digest. It just happens. But that's coming from your nervous system. Okay. Same with hormones. So the master hormonal center of your brain is your hypothalamus, thalamus, etc. There's other things too, hippocampus, but limbic centers. All of those control all of the glands of your body. So looking at your pituitary gland, that is what controls your sex hormones, okay, your hormones, everything. So it's basically just the way we evolved.
So basically your nervous system is like the root cause.
Exactly. In many instances. Now, something can happen, like you make gallstones. That has nothing to do, probably, well, it can have to do with the nervous system, but most of the time it doesn't. There's other factors, a very localized organ issue cannot be related to the nervous system. But you would be surprised as a clinician how often people come in with chronic digestive issues and there's nothing wrong with their digestive organs. It's all mediated by stress, okay, and their nervous system, their parasympathetic nervous system, their vagus nerve not functioning optimally because of chronic stress. Okay. And it happens all the time. And there's other things like that as well, hormone issues in women especially. I would say probably not upwards of 90% of women's health reproductive issues are related to chronic stress and the fact that it's shutting down their ovaries' capacity to regulate, because the brain says, we don't care about reproduction, we care about survival. We're in fight or flight, it's do or die. We're going to shut that down. And so that's very, very, that's why if your nervous system health and stress is balanced, et cetera, then a lot of, especially these functional sort of questionable, even immune issues, your immune system's regulated by your nervous system. There's a whole branch of medicine, psychoneuroimmunology. Again, stress in childhood relates to your ability or your likelihood of getting chronic illness later in life, like decades later, because of the stress component when the nervous system is developing. So many immune issues, autoimmune issues, other immune deficiencies, chronic infections, not being able to clear infections, getting sick a lot. Very often, again, that's the neuroendocrine axis. So when your brain is firing the wrong signals to the organs of your body that make blood cells, white blood cells, it can cause all sorts of abnormalities, even cancer. Stress is related. Chronic unremitting stress is often related because it suppresses the immune system. It makes your immune system go down, and that can predispose somebody to developing cancers later on from reduced immune surveillance.
Okay, so let me see if I have this right. So lots of things that we experience, like immune issues, anxiety, pain, digestion issues, reproduction issues, cancer, are all related to an underlying factor, which is usually stress, that is stressing the nervous system, and the nervous system is not regulating properly. And so it's manifesting as these other things.
Exactly, or it's downstream leading to an increased risk of these other things. And depending on other environmental and genetic variables, they show up or they don't.
Right.
Obviously, some people can tolerate stress or other stressors on the system far better or for a lot longer than other people. And there's a lot that goes into that, but there's always underlying variables at play. But nervous system dysregulation is, I've learned through clinical practice that it's the root cause of a huge amount of illness.
Yeah, yeah. I find it interesting that it's the root cause, because then you can get diagnosed with something, but there's something else that's related to that. That's even deeper.
Exactly. You can, for example, with, we could say anxiety or pain or cancer or cardiovascular issues, hormonal issues. You could say, okay, so you get a treatment from your doctor, you take a pill or you do something. If you're not dealing with the underlying root cause, which is a dysregulated nervous system, if that is the root cause, then none of the rest of that really matters. You're just sort of treating the symptoms, maybe keeping things at bay a little bit, but sometimes it just drives it deeper because you're not dealing with the root issue. So the problem's still going on. So, okay, these symptoms are gone, but now it's just going to go somewhere else. You always have to get to that root cause if that's the cause.
Got it.